Next, we're going to cover intermittent compression. So we are going to get our patient positioned. There's really only two options for intermittent compression, which is an upper extremity or a lower extremity treatment. And we have sleeves for both of those. So this would be our upper extremity sleeve. It is a little wider at one end, a little more tapered at the other. So this end goes up by the shoulder, this end goes down by the hand and the fingers. I'm going to set up a lower extremity treatment. So we are going to have the patient supine. Again, very important to be supine and not long sitting so that we can return as much fluid back to the heart as possible. We're going to have the lower extremity propped up on the wedge. If they're more comfortable, they can go ahead and put both legs up on top there. Remove the shoe on the side that you're going to be treating, and then we're going to use the lower extremity appliance for this. So I'm going to have the patient lift her leg so that we can place this inside. Prior to applying this sleeve, you are going to want to assess the patient's blood pressure because we don't want our pressure on the machine to exceed the patient's diastolic pressure, and we are also going to take circumferential measurements of the lower extremity. So again, you can use the malleoli as your starting point and work your way up every 2 inches, or you can pick a landmark in the knee and work your way up and down from there, depending on the condition that we're treating. Our patient has on pants, so I'm going to just try to smooth them down a little bit inside the sleeve. You do want to make sure that the heel is lined up into the bend of the heel on the appliance. And then we're just going to zip her up to the top there. From here, we're going to hook up our hose. And hopefully we are long enough to reach over here. So we've connected our hoses. Our machine is now ready to go, so we'll put our settings into the machine. So the first thing I'm going to do is I'm going to turn the machine on. It beeps several times, but you see that nothing happens just yet. I'm going to set my inflation and deflation times. It's on 45 and 15, which is a 3-to-1 ratio, so we can certainly go with that just for fun. We'll change it to 60 and 20, 60 inflation and 20 deflation. Our treatment time is located up here. We have the options of 15, 30, 45, and so on. So choose your appropriate treatment time. If you wanted to do a 20-minute treatment, set it for 30 and then set a separate timer for 20 minutes. So we're set there. In order to actually start to move air through the machine, you need to hit this little button beside the key. And I had to hit it a second time, and then you'll slowly start to turn your pressure up. You should see the sleeve starting to inflate. This takes some time, so you do need to be patient and let the full sleeve start to fill up. You also want to be careful not to turn your pressure up too high to start. If you have too much air go into the machine and it's filling up too high, there isn't a way to get that air out except for to unhook it, manually press the air out, and then restart your treatment. So it's better to start with baby steps with this machine and let it fill up sort of little by little. You will notice, because this is a sequential machine, the foot will fill up first and the air is going to gradually make its way up the leg. Once you have the machine or the appliance all the way full, you can make any fine-tuning adjustments with the pressure. For lower extremity, if it's regular traumatic edema, we typically want to keep our pressures somewhere between 60 and 100, maybe even a little less depending on the patient's diastolic blood pressure. If we're treating lymphedema, we want to keep our pressures between 30 and 40. So just keep looking back to the machine, see where you are, and see if you need to make any adjustments. You will have to stay with the patient probably through a good 3 to 4 cycles to ensure that you're actually at the right pressure, especially with a lower extremity appliance. The sleeve is pretty long, it takes some time to fill up all the chambers. So once you have it full and you have it at your desired pressure, you can leave the patient with a signaling device to get your attention, and then just come back and check on them periodically. When treatment is over, you can simply turn the machine off. Then you're going to unzip the appliance, help the patient if necessary to remove their arm or their leg. You need to unplug the hoses. You can press the air out of the appliance. And then again, we will most likely do some post-treatment circumference measurements to see if our treatment was effective at reducing edema.